Hello, and welcome to the weekly dementia blog. My name is Dr. David Hutchings. These are being offered by Spectrum Med, and we have now developed our entire dementia program. So we're very, very excited to have that up and rolling, and lots of folks who have showed a great interest in that. So last week, just to recap, we had talked about the differences between PDD, which is Parkinson's dementia, versus a Lewy body dementia. And Lewy body dementia, up until the last few years, really has not been talked about in great detail. And as many of you know, this is the condition that Robin Williams had. So that obviously caught a lot of attention of what Lewy body is, and certainly some additional research came out from that. So let's talk about Lewy body. But as we talked about the two dementias associated with Parkinson's disease, again, PDD and Lewy body, one of the biggest clinical indicators for us to determine which one are we dealing with, they do have different symptoms, but it's more so how it onsets. So if we have a movement disorder issue first, and then we develop the dementia second, that's going to be more in the PDD realm, or the Parkinson's with dementia realm. If it's reversed and we have the more cognitive issues first, and then develop the movement disorder second, that's when we're start to look at maybe this could be Lewy body. In some publications, we see the Lewy body is named as the second most prevalent condition behind Alzheimer's and progressive dementias. However, in most publications, I see that the vascular dementia comes second and the Lewy body comes third. So it definitely is worth us discussing and having a blog specifically for Lewy body. If we do get more questions on Lewy body, I'd be happy to make this like a 3 or 4 part series. But let's talk about what Lewy body is. So Lewy body is an abnormal protein deposits that build up in the nerves of the brain that control movement, thinking, and also thinking and cognitive skills. Okay, and then they also have very distinct clinical symptoms that we see. So number one would be visual hallucinations. That's one of the biggest ones we see, and this is one of the first symptoms that actually occur in Lewy body. The patients can see shapes, they can see animals, they can see people, and it's not only visual though, it also could be olfactory, so they can smell things that aren't there or even feel things that aren't there. And then also they have some other symptoms is definitely the movement issues. So, and it's not always just tremors like we would think about with Parkinson's. There's other movement issues that are there. It can be in coordination. It could be speech issues, and we start to hear slurring of speech and that kind of thing. Maybe a low vocal volume. They really can't project their voice. But the biggest problem with the movement issues that we see from the abnormal Lewy body deposits in the brain is the risk of falls. So these patients will have a very shuffling type gait, and so definitely at a risk for fall. They don't have that gait arrhythmia. They don't have the ability to really really have the reflexes as well if they begin to have a fall. Also, unlike Alzheimer's disease, we see autonomic nervous system issues, and we don't typically see that in Alzheimer's until more the later stages. So we can see blood pressure fluctuations, we can see the pulse fluctuations, we see patients sweating, digestive issues. So things that the autonomic nervous system, which are things that we don't think about, heart rate, blood pressure, temperature, blood vessel diameter, these types of things. And then also we have the cognitive loss there. We have the memory issues, attention problems, those types of things. Next, one of the most characteristic behind the visual hallucinations component of Lewy body is the REM sleep disorder behavior. So they don't actually quite get to that REM sleep disorder, and sometimes they can begin to act out those dreams. And then we see a fluctuation in attention. So we see periods of maybe they're staring into space. It's also called a lion gaze, where they just kind of stare. And then periods of maybe drowsiness or sleeping too much. Now, some of the things that we see too in terms of other signs and symptoms, increased depression. We touched briefly on a blog, I think a few weeks ago, talking about pseudo-dementia, which is brought on from depression. So these patients can have pseudo-dementia on top of that. And then increased empathy, and that's just decreased motivation. Some of the risk factors we see is definitely over the age of 60 years old. Again, that's different for Alzheimer's. That we'll see that about at about age 80 is when our risk goes up to about 50%. We do see risk factors higher in men than women, which is also reversed from Alzheimer's disease, and of course, a family history. Some of the complications with Lewy body definitely worth being discussed. We see severe depression, aggression, again, acting out behaviors. The hallucination behaviors can increase aggression as well, increased risk for falls, certainly an increased cognitive loss as well involved with that. And unlike late onset Alzheimer's disease, this is going to be more of a quicker moving type dementia. So we would see that this would, when we see the clinical symptoms, then we'll start to see, patients get quite severe to the hospice stage, within 6 to 8 years. So very similar to a frontal temporal lobe dementia, where they are fairly fast moving in nature. Um, Again, so a lot of these blogs, what we're doing is we're taking on questions, and whether they're sent via email or on our website as well. So definitely keep those coming, because I'm kind of driving some of the topics on this. Now, next week, what we're going to do is we're going to talk a lot about frontal temporal lobe dementia, which is one that I've studied in great detail, and I also work along with Vanderbilt to do some of the support groups that we have for frontal temporal lobe dementia. So we'll go into that. It'll probably be a 2 to 3 part series on frontal temporal, because there's multiple different types, but we'll make sure we cover those and also answer all your questions. So hope everybody is staying safe and healthy out there, and we look forward to seeing you next week. Thank you.